Namaste students, Kusro Bitio. I, JV'n Dr. Narendra Singh SHEKHAWAT, Assistant Professor, Department of SHALYA TANTRA, Faculty of Ayurvedic Science, Jayoti Vidyapeeth, University, Jaipur. In previous class, we discussed about definition and classification of cholelithiasis. In today's class, we will discuss about pathophysiology of gallstone. First of all, decreased bile acid synthesis. Let's begin with pathophysiology. Decreased bile acid synthesis, so increased cholesterol synthesis in the liver, supersaturation of bile with cholesterol, and formation of precipitants. This leads to gallstone cholelithiasis. Then can change inflammatory change is called cholecystitis. So, student, this is the pathophysiology of cholelithiasis. Clinical manifestations may develop two types of symptoms due to disease of the gallbladder itself. Due to obstructive bile passage by a gallstone, may be acute or chronic. Epigastric distress such as fullness, abdominal distension, and vague pain in the right upper quadrant may follow a meal rich in fat and fatty foods. Sorry. Pain and biliary colic. Gallstone obstruct the cystic ducts, become distended, inflamed, and eventually infected. Acute cholecystitis develop a fever and may have a palpable abdominal mass. May have biliary colic with excruciating upper right abdominal pain that radiates to back and right shoulder is usually associated with nausea and vomiting and is noticeable several hours after a heavy meal. Move about restlessly, unable to find a comfortable position. The pain is constant rather than colicky. Such a bout of biliary colic is caused by contractions of the gallbladder, which cannot release bile because of obstruction by the stone. When distended, the fundus of gallbladder comes in contact with the abdominal wall in the region of the right, ninth, and 10th costal cartilage. Produces marked tenderness in right upper quadrant on deep inspiration and prevents full inspiratory exertion. If dislodged and no longer obstruct the cystic duct, the gallbladder drains and inflammatory process subside after a relatively short time. If it continues to obstruct the duct, abscess, necrosis, and perforation with generalized peritonitis may result. Other symptoms are jaundice. Occurs in a few patients and usually occurs with the obstruction of gallbladder, common bile duct. The bile, which is no longer carried to the duodenum, is absorbed by the blood and gives the skin and mucous membrane a yellow color, frequently accompanied by marked itching of the skin. Change in urine and stool color. The excretion of bile pigments by the kidney gives the urine a very dark color. The feces no longer colored with bile pigments are grayish like putty and usually described as clay colored. Vitamin deficiency. Obstruction of bile flow also interferes with the absorption of the fat soluble vitamin A, D, E, K. May exhibit deficiency of these vitamins. If biliary obstruction has been prolonged, example bleeding caused by vitamin K deficiency, which interferes with normal blood clotting. Assessment and diagnostic findings. Abdominal ultrasound, ultrasonography, radionucleosynthesis, radionuclide imaging or cholecystography, cholecystography, Endos- endoscopic retrograde cholangiopancreatopathy. This is called ERCP. Next, percutaneous transhepatic cholangiography. This is called PTC. Abdominal ultrasound. If gallbladder stone is suspected, an abdominal X-ray may be obtained to exclude other cause of symptoms. However, only 10 to 15 gallstones are calcified sufficiently to visible on such X-ray studies. Ultrasonography replaced cholecystography as the diagnostic procedure of choice. It does not expose patient to ionizing radiation. Most accurate if the patient facts overnight so that the gallbladder is distended. Detect calculi in the gallbladder or a dilated common bile duct with a 90% accuracy. Obesity, ascites, and distended bowel may be difficult to examine satisfactorily with an ultrasound. Stones are acoustically dense and produce an acoustic shadow. Stones also move with changes in position. Polyps may be calcified and reflect shadow but do not move with a change in posture. Thickened gallbladder wall and local tenderness indicate cholecystitis. When a stone obstructs the neck of the gallbladder may become very large but thin-walled. A contracted, thick-walled gallbladder indicates chronic cholecystitis. This is the USG of cholelithiasis, gallstone and gallbladder. Radionuclide imaging cholecystography. Used successfully in the diagnosis of acute cholecystitis or blockage of a bile duct. Radioactive agent is administered IV, taken up by the hepatocytes and excreted rapidly throughout the biliary tract. Then scanned and image of the gallbladder and biliary tracts are obtained. This is the high-dye scan of gallbladder. More expensive than USG, takes longer time to perform, expose the patient to radiation, often used when ultrasonography is not conclusive, such as acalculous cholecystitis. Cholecystography has been replaced by ultrasonography as the best of choice. Oral cholangiography may be performed to detect gallstone and to assess the ability of the gallbladder to fill concentrate. It contains contract and empty. Iodine containing contrast agent excreted by the liver and concentrate in the gallbladder is administered to the patient. Normal gallbladder filled with this radio-opaque substance appear as shadow on the X-ray film. Contrast agents include ionopathic acid, iodinopamide, megolamine, sodium apodate, administered orally 10 to 12 hours before the X-ray study. To prevent contraction and emptying the gallbladder, the patient is nil after the contrast agent is administered. Asked about allergies to iodine and seafood. An X-ray of the right upper abdomen is obtained if the gallbladder is found to fill and empty normally and to contain no stone gallbladder disease is ruled out. Okay, student, this is the image of cholecystography. Okay, student. Rest of radio techniques will discuss in next class. Okay, student, this is all about the diagnostic technique, some diagnostic technique of cholelithiasis. This session is powered by Digital Session 2.0 Jyoti Vidyapeeth 1 Jaipur. I hope you are satisfied with this discussion. If you have any doubt and queries, please mention in comment box. I will resolve it soon. Thank you, students.